Hi, Christine. This is Wendy. I wanted to respond to your discussion board post, and I really felt like you identified some key issues with regards to mental health policy development. Um, the first point that you make that I think is very true and important to consider is that really the attitudes of those in authority or those making the decisions about policy regarding resources for their country can really determine the success of policy development. Disagreement, amongst a team could really lead to um, maybe ill feelings, a lack of follow through if there's really no resolve, or perhaps even sabotage, that I think is possible, although certainly one would hope that on behalf of people who need services that would not happen. I have seen some of this even in my mental health community. I know one time I was on a multidisciplinary team in a meeting, and um, the psychiatrist that was present in the meeting was just in disagreement and frustrated and just walked out of the room, which I felt like was very unprofessional, but I know that certain people can get caught up in titles and credentials, and that can be a problem at times. Thankfully I haven't experienced that often, but I have seen it here and there, even in my own community. So really humility is needed for the greater good of what do the people need, with those involved in negotiating mental health policy, and hopefully, somebody to lead those kind of groups would be skilled at negotiation and how things are presented. I think of the example of when things can go, maybe go wrong or get stalled out in implementation of mental health policy. For example, El Salvador, the country that I have been studying. There was a study done by Nichols et al. In 2018. The article is entitled Access to Mental Health Care in El Salvador, a case study of progress towards decentralization, and this is on the PubMed website. But they really, this study clearly shows that El Salvador chose to do a national psychiatric hospital and concentrate their budget solely on that, and that really that left 45% of the population, almost half, in rural areas with no really access or very hardship to get to the capital and receive psychiatric services. So in their evaluation of the program, or the plans, the policy implementation, by the end of 2015, El Salvador had placed psychiatrists in 11 of 30 of the country's public hospitals, so it seemed to be some progress was being made, and also they had a program to train their primary care physicians in the World Health Organization's Mental Health Gap Action Plan. So this did move forward and was moving forward in 2015. Yet when the researchers who did this study looked at it, I guess, reevaluated by the end of 2016, December of 2016, the Ministry of Health in El Salvador had only trained 5.7% of the public health doctors in the Mental Health Gap Action Plan, and came to the conclusion that the program was at a standstill. So that just leaves me to wonder, were there conflicts, attitudes? Did they just run out of resources? But what really happened? And I really absolutely love your solution that the information presented in teams like this really needs to be evidence-based. And I think similarly, if they can look at other countries maybe who have similar budgets, that may be an encouragement, and that those involved need to be listened to, maybe a skillful negotiator to head all of that up. So to resolve any kind of conflict or issues. So thank you so much for your post. Really thought-provoking, and just a good discussion. Thanks. I'll see you around class. Bye.